So this is how we classify the ovulatory disorders according to the WHO classification. So if FSH and LH are both low, what do you think? Where is the problem? FSH and LH are both low. Do you think the problem is at ovary, pituitary, hypothalamus? Where is the problem? Yeah, so it's either pituitary or hypothalamus. Yes, it's either here or here क्योंकि यहीं से ये बन ही नहीं रहा है. So basically it's the class 1 hypogonadotropic hypogonadism with causes in hypothalamus pituitary. There can be a mass lesion, so we can do an MRI here, or a Sheehan syndrome, previous pregnancy, history of bleed, no breastfeeding, then amenorrhea. Anorexia, stress, excessive exercise, all of them act at the level of. So there's a famous athletes triad also. So it's when somebody is doing too much exercise and all, then also it acts at directly here. Now there is a eugonadotropic estrogen sufficient ovulatory disorder, which classical example is PCOS. Okay, so it is just dysfunctional. Hormones की report करोगे तो they may be just normal. ठीक है, and the two hormones mainly we use are FSH and estrogen. Additionally, LH can be done to help. LH will especially be useful in this case to, if it is high, especially it gives you a little more idea that it's an androgenic basis. And if FSH is high and estrogen is low, then where is the problem? Estrogen is low and FSH is high. So what do you think? Where is the problem? At the level of ovary. Yes, because ovary is not secreting estrogen, तो negative feedback नहीं जा रहा है, तो pituitary को लग रहा है कि I have to secrete more FSH, so it has increased it above the levels, more than 20 चला गया. ठीक है, so hypergonadotropic. So ovary is the problem. What can be the issues? It can be a primary ovarian insufficiency, it can be a monosomy X, the Turner syndrome, gonadal dysgenesis, or it can be secondary to surgery, chemotherapy, radiotherapy induced, or anything.